This platform really has allowed us to increase our access to telemedicine and has really allowed our physicians to utilize telemedicine at a greater level. It's fundamentally changed how we think about telemedicine and how we practice telemedicine.
The mission of the California Telehealth Network is really to expand access to healthcare with a focus on rural and medically underserved urban communities. We use broadband technology as well as other advanced health IT technologies to do this. We were really conceived by an amazing consortium of stakeholder organizations that come from all over the spectrum in California. These stakeholders came together to try to put in place the digital infrastructure that would be required to allow all healthcare providers in California to be able to access the resources they need, whether they're in rural, whether they're urban, whether they're for-profit or nonprofit. Patients in these remote areas now can have access to specialty care that wasn't available to them before.
Availability of telemedicine in a small town hospital really changes the game for us. From my perspective, it's really valuable to have subspecialists such as Dr. Siddiqui or infectious disease consultant available 24/7 to really help improve patient care and to expedite the patient's care and actually expedite their discharge.
Telemedicine by its very nature allows me to be far more efficient. I can go to multiple hospitals, I can go to multiple clinics, and I can, at the end of the day, see a lot more patients.
Today, we're serving over 780 locations around the state of California. Less than 20% of our locations actually have on-site IT resources. Before we actually adopted this technology, many of our sites were struggling trying to figure it out. They were using Skype, they were using other kinds of web-based video conferencing platforms that were not secure, that did not provide the picture quality and audio quality that would support the doctor and patient experience. The marriage with Vidyo really was born out of that need to find a simple solution that would work across multiple platforms, that could be used in settings where there are no IT resources.
You can actually use your desktop to have a high-definition, encrypted technology healthcare session. That becomes very important because as we look at going forward, what we see is there's laptops in every exam room, there's cameras in every exam room that are attached to the laptops, and it gives us the ability to do telehealth in those environments. Part of our requirement was that it had to interface the legacy systems that were out there. There was a lot of dollars spent to provide those types of products, and whatever we did going forward with the cloud-based technology needed to interface that seamlessly, which we see with this product.
Okay, CTN Connect provides diagnostic quality. It is so much easier. You can just see if the patient gets sad or gets angry, gets agitated, you can identify everything through the camera.
With CTN Connect, I noticed that the quality is very clear, so the client is able to see the doctor clearly, and the doctor can read the client's nonverbal communication very well.
When we decided to switch to the Arkadin video platform, it really allowed us to rethink how we were conducting telemedicine. No longer were we limited by the hardware. Now we were able to use a software-based telemedicine product that allowed us to increase the number of endpoints that we had. So all of our physicians were able to use whatever device they were familiar with, whatever device they were comfortable with. It allowed us to connect to whether it be legacy units or other users of the Arkadin video platform.
I feel I get everything I need from the virtual encounter that I do from the face-to-face. I definitely think it's accelerated the therapy, and I definitely think it's been beneficial.
It was nice in our small town, in our small hospital here, that we had the expertise of a world-class physician helping heal our daughter, and it was amazing.